Are integrative treatment interventions like Ayurveda or acupuncture or homeopathy worth trying for mental health? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and this question came up from one of my commenters recently. And I'm going to focus on interventions other than supplements in this video because that's a whole topic in and of itself. And so maybe I will address that in another video. Additionally, this is just a broad overview. There are so many different integrative modalities, practices that you could try. So this is just scratching the surface. So integrative treatment options are treatment options that are not traditionally associated with Western medicine. A lot of them are going to come from more Eastern type practices or South Asian or just from different traditions. So this can include things like moving meditations like Qigong or Tai Chi or yoga. It could include things like acupuncture or like homeopathy, which is basically where you're giving very, very low doses of things. It could be a potential medicine or a potential toxin and treating the body in that way. It could be something like hypnotherapy or Ayurveda, which is the traditional Indian practice of using different spices and herbs to treat the body, and also can integrate moving meditations like yoga as well. So there are a few things that I think of when it comes to this question. First is, what are the belief systems of the patient? If I have someone who is very attached to Western medicine, then I'm probably not going to suggest something like acupuncture or Qigong because it's just not something that aligns with that person's belief system. And so it's probably not going to be that effective for them. The second thing is that there is a lot of evidence for a number of these different interventions to show benefit for mental and physical health conditions. So things like yoga, mindfulness meditation, acupuncture, we have a lot of data showing that these things are actually quite effective. And there is significant value in the wisdom that comes from these other cultural practices and interventions. The Western way is not always the right way. And then lastly, even if a person is experiencing primarily a placebo type benefit from these interventions, which may or may not be the case, so what? We have plenty of studies to show that our antidepressants are not much more effective than placebo, if at all. And I would argue that the potential risks of those antidepressants are probably much greater than something like yoga or acupuncture. So when you're weighing the potential benefits of an intervention against the potential risks, there certainly may be cases where it makes sense to pursue one of these integrative modalities over some other traditional Western interventions. There also may be cases where this is not true, and I would advise starting with an antipsychotic or a mood stabilizer, acutely address any safety concerns that there might be. Where I would caution people is, in general, if someone is trying to sell you some intervention saying that it is going to be a cure-all for things and that it's not going to have any negative effects and, it costs this amount of money, certainly keep in mind that there really is no magic solution for most of our conditions. And so I would be cautious if that's how things are being advertised. And a lot of times the main downside is the money and the time that you are spending investing in these different interventions. So unfortunately, a lot of them aren't going to be covered by insurance. However, there certainly are insurance providers who cover things like acupuncture and chiropractic care. So it's not impossible, but there are certainly cases where these interventions are only available to those who can afford them. But if there's been an integrative modality that you have found super helpful for you, or if there's one that you want to hear me talk a little bit more in detail about, then let me know in the comments. Additionally, if you're interested in getting more direct resources and content from myself, I do have an email list and I'm sending out bi-weekly emails. So if that's you, then send me a DM with your email and I'll see you in the next one.